The ancient Egyptian civilization, spanning over 3 millennia, developed sophisticated approaches to personal hygiene and intimate care that reflected both their advanced understanding of medicine and their complex religious beliefs. The pharaohs, as divine rulers who serve as intermediaries between the mortal world and the gods, maintained particularly elaborate hygiene practices that were documented extensively in papyrus texts, tomb inscriptions, and archaeological evidence. These practices encompassed not only cleanliness for health purposes, but also ritual purification, contraceptive methods, and treatments for intimate health concerns that reveal a remarkable degree of medical knowledge for their time. The foundation of Egyptian intimate hygiene rested upon their understanding of cleanliness as both a physical and spiritual necessity. The concept of ritual purity, known as web, was fundamental to Egyptian religious practice and required extensive ablutions before engaging in sacred activities. For the pharaoh, who performed daily religious duties as the high priest of every temple in Egypt, maintaining perfect cleanliness was not merely a personal preference, but a divine obligation. This religious imperative drove the development of sophisticated bathing facilities, specialized servants dedicated to royal hygiene, and complex protocols that governed every aspect of personal care. Archaeological excavations of royal palaces and tombs have revealed extensive evidence of the elaborate bathing facilities used by Egyptian royalty. The palace complexes at Amarna, Memphis, and Thebes contain sophisticated bathroom installations with limestone basins, drainage systems, and dedicated spaces for personal grooming. These facilities included specialized areas for different aspects of hygiene, including separate spaces for general bathing, intimate washing, and the application of cosmetics and perfumes. The tomb of Ka, an architect during the New Kingdom, contained a complete set of toiletries including razors, tweezers, coal containers, and various vessels for oils and unguents, providing insight into the daily hygiene routines of the Egyptian elite. The Edwin Smith Papyrus and the Ebers Papyrus, two of the most important medical texts from ancient Egypt, contain numerous references to intimate hygiene practices and gynecological treatments used by the royal physicians. These documents, dating to approximately 1600 BCE, but containing knowledge from much earlier periods, describe detailed protocols for maintaining feminine hygiene, treating reproductive health issues, and preventing conception. The level of medical sophistication demonstrated in these texts indicates that Egyptian physicians possessed a comprehensive understanding of anatomy and physiology that informed their approach to intimate care. Water played a central role in Egyptian hygiene practices, but its use was governed by strict protocols that distinguished between different types of cleansing. The Nile River, considered sacred and life-giving, provided water for general bathing, but intimate washing often required specially prepared water infused with herbs, salt, or other purifying substances. Royal bathing rituals frequently incorporated natron, a naturally occurring mixture of sodium carbonate and sodium bicarbonate that possessed both cleansing and preservative properties. This mineral, also used in mummification, was dissolved in water to create alkaline solutions that were believed to provide superior cleansing and protection against impurities. The role of specialized servants in maintaining royal hygiene cannot be understated. Hieroglyphic inscriptions and tomb paintings depict numerous attendants dedicated specifically to the personal care of the pharaoh and royal family members. These servants, often referred to as pure ones or clean ones, underwent ritual purification themselves before being permitted to attend to royal hygiene needs. Their duties included preparing bathing waters, maintaining cleanliness of intimate garments, and assisting with the application of various oils, unguents, and protective substances. The tomb of Amenhotep II contains detailed lists of these servants and their specific responsibilities, indicating the highly organized nature of royal hygiene protocols. Egyptian textile production and garment construction reflected their sophisticated understanding of intimate hygiene requirements. Linen, produced from flax grown along the Nile, was the preferred fabric for intimate garments due to its absorbent properties, breathability, and ease of cleaning. Archaeological analysis of linen fragments found in royal tombs reveals extremely fine weaving techniques that produced fabrics with thread counts comparable to modern high-quality textiles. These garments were frequently replaced and subjected to intensive washing procedures using natron solutions and aromatic herbs. The tomb inventories of several pharaohs include hundreds of linen garments specifically designated for intimate wear, indicating the importance placed on maintaining fresh, clean clothing next to the skin. The preparation and use of intimate cleansing substances represented a sophisticated understanding of both chemistry and biology. Egyptian physicians prepared various solutions for intimate washing using combinations of honey, salt, wine, and plant extracts. Honey, recognized for its antimicrobial properties, was frequently incorporated into cleansing preparations and contraceptive pessaries. Salt solutions, derived from both sea salt and mineral deposits, were used for their antiseptic qualities. Wine, particularly when combined with aromatic herbs, served both as a solvent for other ingredients and as a mild antiseptic. The Hygiene gynecological papyrus contains specific recipes for these preparations, including detailed instructions for the preparation and application. Royal women received particular attention regarding intimate hygiene, reflecting both their elevated status and the importance placed on their reproductive health for dynastic succession. The inscriptions in the tomb of Queen Nefertari describe elaborate daily cleansing rituals that included multiple stages of washing with different solutions, the application of protective oils, and the use of aromatic substances for both hygienic and aesthetic purposes. These practices were supervised by specialized female attendants who possessed extensive knowledge of feminine hygiene and were responsible for maintaining the queen's health and fertility. The integration of religious beliefs with hygiene practices created complex protocols that governed intimate cleansing in relation to religious observances, sexual activity, and menstruation. Egyptian religious texts outline specific purification requirements following sexual intercourse, during menstrual periods, and before participating in religious ceremonies. These protocols required not only physical cleansing, but also specified waiting periods and the use of particular substances believed to restore ritual purity. The temple archives at Karnak contain extensive records of these purification protocols and their application to royal family members. Evidence from mummy examinations provides direct insight into the effectiveness of Egyptian intimate hygiene practices. Analysis of royal mummies has revealed remarkably well-preserved tissues and minimal evidence of infections or diseases that might be expected in populations with poor hygiene standards. The mummy of Ramesses II, who lived to approximately 90 years of age, shows evidence of excellent dental health and no signs of systemic infections that might result from poor intimate hygiene. Similarly, the mummy of Queen Hatshepsut, despite her advanced age at death, showed no evidence of reproductive tract infections or other conditions that might indicate inadequate intimate care. The contraceptive methods employed by ancient Egyptian royalty demonstrate a sophisticated understanding of reproductive physiology and represent some of the earliest documented birth control practices in human history. The pharaohs and their consorts had access to the most advanced medical knowledge of their time, including various methods for preventing conception that were documented in medical papyri and evidenced through archaeological findings. These methods range from barrier techniques using natural materials to chemical contraceptives that exploited the properties of various plants and minerals. The Hygiene gynecological papyrus, dating to approximately 1800 BCE, contains the world's oldest known written descriptions of contraceptive techniques. These methods included the use of pessaries made from crocodile dung, honey, and sodium carbonate, which were inserted vaginally to create both physical and chemical barriers to conception. While modern sensibilities might find the use of crocodile dung objectionable, analysis has shown that this substance, when dried, becomes alkaline and may have possessed spermicidal properties. The honey component provided antimicrobial protection and helped maintain the consistency of the pessary, while sodium carbonate created an alkaline environment hostile to sperm survival. Archaeological evidence from royal tombs has revealed numerous objects that appear to have served contraceptive purposes. The tomb of Queen Nefertiti contains several small vessels with residues that chemical analysis has identified as containing traces of silphium, a now extinct plant that was highly prized in the ancient world for its contraceptive properties. Historical sources indicate that silphium was so valuable for birth control that it was worth its weight in silver and may have been driven to extinction due to overconsumption. The presence of these vessels in royal tombs suggests that even the most elevated members of Egyptian society relied on plant-based contraceptives. The medical understanding demonstrated in Egyptian contraceptive practices reveals sophisticated knowledge of female reproductive cycles and the timing of fertility. The Ebers Papyrus contains descriptions of methods for determining fertile periods and techniques for avoiding conception during these times. These methods included observing cervical changes, tracking menstrual cycles, and using various herbal preparations to suppress ovulation. The accuracy of these observations is remarkable considering the limited technological tools available to ancient physicians. Royal women also had access to more elaborate contraceptive preparations that incorporated rare and expensive ingredients. Inscriptions from the tomb of Queen Tai describe contraceptive recipes that included frankincense, myrrh, and other aromatics imported from distant lands. These preparations were not only functional, but also served to distinguish royal contraceptive practices from those available to common people. The expense and rarity of these ingredients reflected the importance placed on controlling royal reproduction and ensuring that pregnancies occurred only when desired for dynastic purposes. The role of court physicians in managing royal reproduction extended beyond simple contraception to include sophisticated understanding of timing conception for optimal outcomes. Medical papyri describe techniques for enhancing fertility when pregnancy was desired and methods for preventing conception when it was not. This dual approach required extensive knowledge of both male and female reproductive physiology and the ability to coordinate various treatments and interventions. The tomb inscriptions of several royal physicians indicate that they held specialized titles related to reproductive health and were among the most respected members of the court medical staff. Barrier methods of contraception used by Egyptian royalty included both physical devices and chemical preparations designed to prevent sperm from reaching the cervix. Archaeological analysis of materials found in royal tombs has identified several objects that appear to have functioned as primitive diaphragms or cervical caps. These devices were crafted from various materials, including animal membranes, plant fibers, and even thin sheets of precious metals. The sophistication of their construction suggests that Egyptian craftsmen possessed detailed knowledge of female anatomy and the requirements for effective barrier contraception. The use of herbal contraceptives by Egyptian royalty involved extensive knowledge of plant pharmacology and required careful preparation and administration by skilled practitioners. The Edwin Smith Papyrus contains detailed descriptions of various plants used for contraceptive purposes, including instructions for harvesting, processing, and preparing these materials. Some of these plants, such as Queen Anne's lace and wild carrot, are now known to possess compounds that can affect hormonal balance and reproductive function. The precision with which these preparations were described suggests that Egyptian physicians had conducted systematic observations of their effectiveness. Menstrual regulation represented another aspect of intimate health management among Egyptian royalty. Medical texts describe various methods for managing menstrual flow, treating irregularities, and addressing menstrual-related health concerns. These methods included dietary modifications, herbal treatments, and physical interventions designed to maintain reproductive health. The tomb of Queen Almost Nefertari contains extensive inventories of materials used for menstrual management, including specialized absorbent materials and cleansing preparations specifically designed for use during menstruation. The integration of magical and medical practices in Egyptian contraception reflects the holistic approach to health characteristic of ancient Egyptian medicine. Contraceptive preparations often included not only pharmacologically active ingredients, but also substances believed to possess magical properties. Amulets and charms were frequently used in conjunction with physical contraceptive methods, and the timing of contraceptive interventions was often coordinated with astronomical observations and religious festivals. This integration of practical and mystical elements demonstrates the comprehensive worldview that governed Egyptian approaches to reproductive health. Royal birth control practices also involved male participation, with evidence suggesting that Egyptian men used various methods to prevent conception. Historical sources describe the use of sheaths made from animal membranes and various topical preparations applied to male reproductive organs. The tomb of Tutankhamun contains several objects that may have served as primitive condoms, crafted from finely treated leather and designed to prevent both conception and the transmission of diseases. These findings suggest that responsibility for contraception was shared between partners rather than placed exclusively on women. The effectiveness of Egyptian contraceptive methods can be partially assessed through analysis of royal family sizes and birth spacing patterns. Examination of historical records reveals that many Egyptian queens had relatively few children despite long marriages, suggesting successful use of contraceptive techniques. The spacing between children in royal families often shows regular intervals that would be consistent with the use of effective birth control methods. Queen Nefertiti, for example, is known to have had 6 daughters over a period of approximately 15 years, suggesting deliberate family planning rather than unrestricted fertility. Documentation of contraceptive failures and their management provides additional insight into Egyptian reproductive practices. Medical papyri describe methods for terminating unwanted pregnancies, indicating that Egyptian physicians possessed knowledge of abortifacient techniques when contraception proved unsuccessful. These methods included both herbal preparations and physical interventions, though such procedures were apparently reserved for extreme circumstances and required extensive ritual purification following their use. The treatment of intimate health conditions among Egyptian royalty reveals an advanced understanding of gynecological and urological medicine that surpassed contemporary civilizations in many respects. Royal physicians, known as Su, specialized in various aspects of intimate health and developed sophisticated diagnostic and therapeutic approaches to conditions affecting reproductive and urinary systems. The medical papyri of ancient Egypt contain extensive descriptions of these conditions and their treatments, providing remarkable insight into the state of intimate health care available to the pharaohs and their families. Gynecological conditions affecting royal women receive particular attention due to their potential impact on dynastic succession and the perceived connection between feminine health and cosmic order. The Berlin Medical Papyrus contains detailed descriptions of various uterine and vaginal conditions, including infections, prolapse, and menstrual irregularities. Treatment protocols included both internal and external applications of medicinal preparations, surgical interventions, and dietary modifications. The sophistication of these treatments is evidenced by the specific anatomical knowledge required for their application and the complexity of the pharmaceutical preparations involved. Vaginal infections and their treatment represented a significant concern for royal women, given the potential complications for both general health and reproductive function. Egyptian physicians developed various treatments for these conditions using combinations of antiseptic substances, pH-balancing agents, and antimicrobial compounds. Honey, recognized for its antibacterial properties, was frequently used in vaginal suppositories and douching solutions. Garlic, now known to possess antifungal properties, was incorporated into various preparations for treating yeast infections. The precision with which these treatments were described suggests that Egyptian physicians had systematic methods for diagnosing different types of infections and selecting appropriate remedies. Urological conditions affecting both male and female royalty were addressed through a combination of dietary interventions, herbal medicines, and physical treatments. The Edwin Smith Papyrus describes various conditions affecting urinary function, including kidney stones, urinary tract infections, and bladder disorders. Treatment protocols often involve the use of diuretic herbs to increase urine flow, antiseptic preparations to combat infections, and pain-relieving substances to manage discomfort. The tomb of Ramesses II contained numerous medical implements that appear to have been used for urological procedures, including catheters made from precious metals and specialized vessels for collecting urine samples. The management of sexually transmitted infections among Egyptian royalty demonstrates advanced understanding of disease, transmission, and prevention. Medical texts describe various conditions that modern analysis suggests were likely sexually transmitted diseases, including descriptions of genital ulcers, discharge, and systemic symptoms. Treatment protocols emphasized both local treatment of symptoms and systemic interventions to address underlying infections. The use of mercury compounds in some preparations suggests that Egyptian physicians may have possessed knowledge of antimicrobial treatments that would not be scientifically validated until much later periods. Fertility treatments available to royal couples included sophisticated understanding of both male and female factors affecting conception. The Kahan Gynecological Papyrus contains numerous prescriptions for enhancing fertility, including treatments for both partners designed to optimize reproductive function. These treatments included dietary modifications emphasizing foods believed to enhance fertility, herbal preparations targeting specific aspects of reproductive physiology, and timing protocols designed to coordinate intercourse with optimal fertility periods. The complexity of these protocols suggests that Egyptian physicians possessed detailed understanding of reproductive cycles and the factors affecting conception. Male intimate health concerns were addressed through specialized treatments that recognize the importance of masculine reproductive function for dynastic continuity. Medical papyri describe various conditions affecting male fertility and sexual function, including treatments for impotence, premature ejaculation, and various genital conditions. The tomb of Amenhotep III contains several objects that appear to have been used for treating male intimate health conditions, including specialized applicators for topical medicines and devices that may have served therapeutic purposes for genital conditions. The use of surgical interventions for intimate health conditions demonstrates remarkable surgical capabilities among Egyptian physicians. Evidence from mummy examinations reveals that Egyptian surgeons performed various procedures on reproductive organs, including circumcision, treatment of genital tumors, and repair of traumatic injuries. The precision of these procedures, evidenced by examination of preserved tissue, suggests that Egyptian surgeons possessed sophisticated knowledge of anatomy and surgical technique. Surgical instruments found in tombs of royal physicians include specialized tools designed specifically for intimate surgical procedures. Diagnostic techniques employed by Egyptian physicians for intimate health conditions included both physical examination and analysis of various bodily secretions. The Ebers Papyrus describes methods for examining urine, vaginal discharge, and other secretions to diagnose various conditions. These diagnostic protocols included observations of color, consistency, odor, and other characteristics that could indicate specific health conditions. The accuracy of these diagnostic methods is evidenced by the specificity of treatments prescribed for different conditions, suggesting that Egyptian physicians could reliably distinguish between various intimate health disorders. The preparation and administration of medicines for intimate health conditions involves sophisticated pharmaceutical knowledge and specialized preparation techniques. Egyptian physicians prepared various suppositories, douches, topical applications, and oral medications specifically for treating intimate health conditions. These preparations often involve complex processes including fermentation, distillation, and combination of multiple ingredients in specific proportions. The tomb of Imhotep, the legendary physician and architect, contained extensive pharmaceutical equipment, including vessels specifically designed for preparing intimate medicines and specialized applicators for their administration. Preventive care for intimate health among Egyptian royalty included regular examinations, prophylactic treatments, and lifestyle modifications designed to maintain optimal reproductive and urinary health. Court physicians conducted regular assessments of royal family members and implemented preventive protocols based on individual health status and risk factors. These protocols included dietary recommendations, exercise regimens, and the use of prophylactic medications during periods of increased risk for various conditions. The comprehensive nature of these preventive programs reflects the high priority placed on maintaining royal health and the advanced understanding of disease prevention possessed by Egyptian physicians. The integration of intimate healthcare with religious and magical practices created comprehensive treatment approaches that addressed both physical and spiritual aspects of health conditions. Treatment protocols often included not only medical interventions, but also ritual purification ceremonies, amulets, and incantations believed to enhance healing. The tomb inscriptions of several royal physicians indicate that they held religious titles in addition to medical ones, reflecting the integrated approach to healing characteristic of Egyptian medicine. This holistic approach to intimate healthcare represents one of the most sophisticated medical systems of the ancient world and provided Egyptian royalty with healthcare that would not be matched in many respects until the modern era.